Hey, Azang essay.
Hello. This video will cover some general aspects of the modalities and techniques that are used in rehab and recovery from injuries. The general healing timelines are just that. They're general and are subject to change due to a multitude of causes. This is one reason that evaluating movements each session and tracking progression is important throughout the entire rehabilitative process. Injuries can occur from single events such as a bone fracture or a complete tearing of tissue, or they can come from overuse problems where the tissue acquires some type of stress and it keeps accumulating this stress or issue or trauma over a certain time period, and that leads to a larger injury. This is also known as the injury cycle, or in Eastern medicine, the insult injury cycle, which there's a trauma, an inflammation response, a spasm or degeneration of the tissue, followed by some type of adhesion or restricted movement, which then alters the neuromuscular control and leads to a muscle imbalance. And that muscle imbalance could reinforce the original injury and just keeps on repeating in this circular fashion.
Triangle has like a corner in the end. This one is a circle.
Determining the state and stage of the injury allows for an appropriate selection of modalities to be implemented during the rehab and recovery process. Some modalities can be used throughout the entire time, but the way that they are applied will change depending on how the tissue is healing and feedback from the patient and/or client. For many of the modalities, it is important to receive professional instruction on the use of any equipment or application of techniques. Professional instruction is usually done in person, and upon successful completion of training, a certificate is awarded. This isn't always the case of being awarded a certificate for completing training because not all modalities have training for them. But usually any type of university level course in injury management or athletic training will cover several modalities, and you will receive hands-on training. Manual therapy or medical massage or sports massage all have the same end goal in mind, which is to mobilize the affected joint and/or tissue into a pain-free range of motion. There are several techniques and applications that can be used in manual therapy, but some are reserved for certain practitioners only. Manual therapy is also very useful when collagen fiber is being laid down during the repairing process, because what ends up happening in most cases is that the tissue getting laid down, just like scar tissue, is in a crisscross or X pattern, and this is good for the healing process, but in terms of structural integrity for the tissue, it's not. And it needs to be, the alignment needs to be more parallel. And manual therapy can help break up some of these mini scars and break up this crisscross pattern into a more parallel pattern. One modality that I forgot to include was cryotherapy. And cryotherapy can be done locally, just like on a hand or wrist or foot or ankle. Those are the usual areas because they're close to the surface and there's not a lot of tissue around the surface. But cryotherapy is also done in a systemic fashion, which the patient or client would sit inside of a booth and the entire body would be shocked with like a cold atmosphere. And that is also good just for like general recovery, it can be helpful. During the rehabilitative or recovery process, it is important that the client or athlete performs self-care in order to maintain the unrestricted motion or gain in function which was established by the professional intervention. Self-care is done without direct supervision, so it's important that proper instruction is given and how to use or apply the techniques. It's also a good idea to incorporate whatever it is that you want to use for self-care within the supervised program so that the athlete or client is familiar with what they need to do, and this will help with adherence to a self-care protocol. There are several methods and programs that can be used in a rehabilitative or recovery protocol. Many incorporate a principle of progressive overload in either weight, volume, or in a combination together. When choosing a program, it's important to remember that circumstances will change. The patient or client their status will change, and the program needs to meet the changes. So stay flexible with the program and don't be afraid to add or drop something from it. This is a basic template for hamstring strains. It's not specific for any type of injury to the hamstring or for any person. The exercises are pretty basic and they can be exchanged for whatever you like. There are 3 phases which are divided by a criteria which needs to be met before progressing to the next phase. On the second phase, the RPE can start to be progressed from low to high, which will help in the conditioning for higher intensity movements. Returning to play too soon can increase the risk of re-injuring the original issue or the original injury. It can also make it worse or exacerbate it to a point where it needs surgery to repair, or it needs another or follow-on surgery to repair whatever the issue is. Also, returning slowly or late to play is detrimental as well. And it's because the athlete or client can lose motivation or drive. You know, their life force kind of gets drained out of them because they spent so long in therapy and thinking it's never going to end and they're always going to be in pain. This can basically down-regulate the intensity or take away the passion that they have for whatever it is that they were doing. That's why it is essential to establish criteria for returning to play and optimal recovery. I like to use different exercises and different types of exercise protocols, 2 of which, one is called Revolution in Motion, and it uses a stability ball with weights at end range of the movements on the stability ball, and I think it's a good complement to traditional exercises. Another one is from Gary Gray and the Gray Institute, and they do the same thing with light weights at end range, but they use more predominantly closed-chained exercises, where Rev and Mo is a bit of a mix between closed-chained and open-chained exercises. But nevertheless, I do like to use both of them and others as well.
I like that. Get it out there. Nice job. That's the way to get the tummy woke up. Now let's go a little transverse plane behind your head. Great job, Shallon. Really throw it back, and you're going to find it's a little easier going that way because you're winding the hip up. A little tougher.
This concludes our video on rehabilitative or recovery protocols. If you have any questions on the slides or what was said, please leave them in the comment section below. And I thank you for watching and listening.